I help and enable people like you with families like yours to be able to live longer in this planet. At this time, I want to ask you permission to help you.
Why does this hurt? That is the question we are answering for you today. Jamie has been in constant pain for quite some time. It's beginning to disrupt her daily life.
Hey doctors, I used to be really active, but lately my knee has been bothering me a lot and it's really keeping me from doing the sports that I really like to do. It's mostly an achy pain, but if I do certain movements like twist it, then it's a really sharp pain that's really unbearable. The pain in my knee has gotten so bad that I really struggle when I walk up and down the stairs. Is there anything that I can do about it?
Imagine stopping your knee arthritis pain without surgery, without steroids and cortisone shots. Imagine not feeling that you need a knee support as you walk or climb stairs. Being able to climb stairs. Being able to do the sports that you want to do. Being able to squat without your knees cracking and without disrupting your daily life. Being able to walk without your knees feeling that they're giving away. Being able to rise from a sitting position, being able to kneel down, not having trouble getting in and out of the car. If you have any of these symptoms or have been diagnosed with knee arthritis, you better listen to this video. My name is Dr. Maz from OsteoArthritis Center of New Jersey. I'm also the author of this book, How to Live Pain-Free and Happy. Drug-free steps for resolving chronic conditions, chronic osteoarthritis, chronic pain. I wrote the book. At the OsteoArthritis Center of New Jersey, we are an elite team of doctors and skilled physical therapists working together in providing an outstanding, compassionate, unique, and individualized treatment focused on you, the patient. We want to end your arthritis pain and end your years of frustration. I'm going to go over this groundbreaking, outstanding, transformational knee arthritis treatment protocol that has helped hundreds of people like you with families like yours. It is recently approved by Medicare and other insurance plans with a great success rate.
My name is Doris Miller. I'm from Wyckoff, and I would like to tell you about this wonderful place that I found, and I read it in the newspaper, and I'm not one to do things on the spur of the moment, and right away I called, made an appointment, I came down. I've had one injection in my knee, and it is just wonderful. I hate to say it because I really can't believe it myself. And I think everyone should really do this if they want to feel better.
Results appear almost immediately. Let me repeat. Immediately within a day or two. Let's discuss what is arthritis first. Most common cause of knee pain is osteoarthritis of knee. If you're diagnosed with a knee condition and do not correct it, it will lead to a pre-arthritic condition. This is common in younger population who are active and involved in sports. Common pre-arthritic conditions are chondromalacia, patellofemoral syndrome, runner's knee. These conditions are pre-arthritic conditions of the knee joint and you need to correct them. The most common signs and symptoms of knee arthritis are, for example, pain with activities, very common, limited range of motion, stiffness of your knee joint, swelling of your knee joint, tenderness along the knee area. This whole area gets swollen. This area, you start having a lot of inflammation that's causing your pain. That will limit and make you unable to go up the stairs like you used to. There is no cushioning over here. The cushioning is gone. You're going to have difficulty walking. Your knee joint cracks and pops as you walk, as you try to climb stairs, as you try to rise. So if you're above 25 years old with knee pain, most likely you have chondromalacia, which is a big fancy word, which simply means you have water and inflammation in your knee. We call that early arthritis. If you're over 50 years old with knee pain, you're likely to have osteoarthritis. This means the calcium is coming out of the bone. You have lost cushioning of the bone. It's supposed to be like this, some space in between the two bones. The space is gone. The calcium is coming out of the bone. You're losing lubrication of your knee joint. As a result, you're experiencing knee cracking, knee pain, and you're unable to do the things that you could do once before.
Hi, my name is Rick Kennedy. I've had arthritis pain in my left knee for quite a long time. I'm now visiting Dr. Maz at MedWell, and he has suggested injections into my knee and also physical therapy. I've only had one injection so far, and the results have really been amazing. I can walk up the steps without any pain. I can go out for my exercises without any pain, and I have to go through 4 more injections, and I'm feeling that by the last injection, I'm going to be totally pain-free.
So, the problem is that the joint space over here, it narrows. When the joint space narrows, you decrease lubrication in this area. When you decrease lubrication in the area, you increase swelling and inflammation. What we need to do the exact opposite. We need to increase the joint space, increase the lubrication, and decrease the swelling and inflammation, and as a result, you're going to have decreased pain, and you can do what you want to do. Just for your information, if you don't know it, pain pills do not lubricate your knees or fix the problem. They also have many side effects and mess up your gut lining, mess up your gut function. So how do we treat your knee? Is our unique and customized protocol that has helped hundreds of knee pain sufferers. Let's go over what is the protocol. At first, you're going to come into this office and you will fill out a specific questionnaire. The questionnaire is designed for finding out how your knee condition is affecting your daily life, what you can do and what you cannot do, and based on that, we'll see what is really going on with your knee. Then we will do standing weight-bearing x-rays of your knee for osteoarthritis assessment. If you have had x-rays, we don't need to do it again. But I want you to know this. It is very common. It is a common mistake that other doctors who attempt to do what we want to do, they take x-rays while the patient is lying down. You cannot take x-rays while the patient is lying down. This is wrong. You have to do standing x-rays. Why? Because you have pain when you're weight bearing and you're standing. You need to take the x-rays in the same position. So if you have had a lying down x-ray, when you come in, we may have to do a standing x-rays. I don't know. You have to see what you're presenting with. About 6 months ago, Mary came to my office with her child. We held her hand step by step, each step of the way, so she can enjoy life and be able to pick up her child, be able to sleep better. With 3 simple steps, defining, designing, and developing a treatment plan that is second to none. How many by shows of hands are interested in the gift? You may also need an ultrasound study to make sure the cause of your symptoms are truly osteoarthritis, which we do in-house. Then our doctors start the administration of hyaluronic to lubricate this area. When we lubricate your knee combined with a specific and appropriate physical therapy protocol administered by trained professionals, that will do the job. It is designed to strengthen your knee in conjunction with Hyalgin administration. So let's go over what is Hyalgin. That I keep on repeating, Hyalgin. What is that? Well, Hyalgin is an FDA-approved, purified compound which is very similar to the synovial fluid that is supposed to be in your knee joint, which is gone. It is like a gel-like substance which we inject in the knee. It's like putting fresh oil on a squeaky door hinge, like putting WD-40 on a rusted, corroded lock. With a small syringe similar to a flu shot syringe. It's not a big syringe, it's a small syringe. We administer this lubricating fluid in your knee in a specific place that it needs to go. So not only it lubricates your knees, it also acts as a shock absorber. So there is more space like this and not like this. We provide a local anesthetic to make it virtually painless. Just similar to a flu shot. This is very effective when it's done 5 times at a frequency of once a week for 5 consecutive weeks in conjunction with physical therapy. This is another area that is commonly missed. The injection and physical therapy goes hand in hand. What does Hyalgin do? Well, take a guess. It improves joint space. Improves this joint space. Okay? It increases lubrication, decreases inflammation, which as a result decreases your pain. So as a result, you can go up and down the stairs. You can play your favorite sports. You can chase after your grandchildren or children. You can do the activities that you could do once before. If you have had Synvisc or other injections for your knee, there is a good chance the medication was good, but the way it was administered in the wrong side of the knee. That's why imaging is very important to be done while we do injection. And that's what we do here. We have imaging to know where we're going to put the shot, so it goes in the proper place. So it's a combination of multiple factors that makes Hyalgin protocol work properly.
I tell you, I look forward to my treatments, and the people here are so professional and so competent that it's just a pleasure to be here.
Can we guarantee if the Hyalgin and physical therapy program that we're going to have, it's going to work? Absolutely not. We cannot guarantee anything in the health field. Are we successful? Yes, very successful. To recap, let's watch our colleague in the doctor's shop.
We did some standing x-rays because that's how Jamie lives her life. And the x-rays look fine. There's no abnormal alignment, no significant osteoarthritis. She had a long course of physical therapy, which also didn't relieve the pain. So the next step is to try these series of injections to get her some pain relief and get her back to her regular activities.
Yeah, because cool skiing photo there. We got to get you back on the water. So what we're going to do today is an injection of a material that may help improve her symptoms, because what you found is that she's got maybe some early osteoarthritis, also known as chondromalacia.
That's exactly it. Early osteoarthritis is called chondromalacia. In young ladies in particular, it's usually around the kneecap area. We take this ampule of this gel-like substance, and then what we do is we just inject it into the knee like that, and we're all done.
It's basically like some WD-40 for the knee.
That's a good way to look at it. It's a lubricant. And the articular cartilage, as we get older, it starts to wear down. And so this is actually the lubricant for that articular cartilage.
So Jamie will get one of these a week for how long?
We typically do it once a week for 3 weeks. And then after that, we gradually get her back to her activities, maybe restart a physical therapy program, and get her back to doing all those activities that she loves to do.
Well, we wish you the best of luck. We want to see you back on the skis soon.
Thank you.
Thank you so much, Dr.
No problem. Happy to do it.
Thanks, Susie.
Next is bracing. This is another area that is commonly missed. During the initial phase of care, you most likely need a special brace. This is what the brace looks like. This brace, the purpose of it is to unload or de-weigh your knee, or for a lack of a better term, take the pressure off your knee joint as you are weight bearing. That's why they call it de-weighing brace or unloader brace. You must use it a few hours a day to open up your knee joint space over here. Okay? That is why we put this brace on you, and we are going to customize it. This is a right knee brace. Okay, so this is the outside of the brace. So with this hinge over here, we customize this brace so it opens up the middle part of your knee, because that's where most amount of arthritis is usually. And if it's the other side, we do the opposite side. So we open up that joint area so the medication can take its effect.
I'm a pretty active person. Horseback rides, skiing, anything to keep active. The pain in my knee has affected my life. On a regular day, there's always a throbbing that has gotten in the way of what I can do on a daily basis. I need to find some treatment for my knee, hopefully nothing invasive, because I don't want surgery.
You gonna see it from your knees?
Oh, that's it.
Let's go take a look.
Thank you.
There's a lot of people that would benefit from non-surgical treatment of knee arthritis. The Bionic Air knee brace actually recreates the natural current exhibited in a normal knee, and function is improved. So it's an excellent alternative for a knee replacement. Did that grating bother you at all?
Yeah.
I can hear it. With Barbara today, once we determine what's the cause of the knee pain and look at her x-rays and determine what options would be available for her. Well, this brace works two ways. It's an unloader brace, so it takes the pressure off your knee joint. It opens up the space. You've collapsed some space in your knee because of the arthritis. This will actually open up the space. The second function is there's an electrical signal in this brace which recreates the natural electrical signal your knee has lost. As you develop the arthritis, that natural signal gets diminished, and then we lose the joint health. By reproducing the electrical stimulation in your knee joint, we reproduce the natural health of your knee joint, and the symptoms get better, your pain gets better, your function improves, and the use of medication goes down dramatically.
How long would you have to wear something like this to start seeing a benefit?
Generally, with the unloading portion, it's immediate. Then over a month or 2 months, you get the electrical stimulation benefit. So there's two components, immediate and then 1 or 2 months down the line.
And we actually have someone on the phone, Marcia, who's been using the Bionic Air knee brace for, I guess, about 1.5 years now. Marcia, have you noticed an improvement?
Oh my gosh, it is so wonderful.
So,
Barbara, you're going to love this.
Oh, fantastic.
And I understand you've gone from being someone who, due to your knee pain, couldn't go out and do the things you wanted to do, but now you're training for a triathlon?
I am. I haven't been able to do triathlons for a couple of years now, and I'm back training and running and biking, and it's a wonderful product.
Well, Marcia, we wish you the best of luck, and thank you for sharing your story, and Barbara, to you as well.
Thank you.
What results do we get with knee osteoarthritis recovery program? We see decreased inflammation immediately. Let me repeat. We decrease inflammation in your knee joint immediately after the first administration. So you're going to have less pain and more mobility. Our patients tell us, I have easier time walking. I have less or no difficulty going up or down the stairs. Or last week I had a patient. Wow, I could kneel down again, Dr. Maz. I couldn't kneel for years. We hear success stories almost every day. A patient could not go out doing the things that she wanted to do, but now she's trying triathlon. She's training. She's biking. She's running. This is huge.
I have my life back. I can do more physical things that I could not do without lifting something and be in tears, really. And all of that has changed with no medication, with no pills, and that's what I was looking for.
So at this time, if you want to potentially and virtually say goodbye to your knee pain, give us a call. We are here for you. Call and speak to one of our new patient coordinators at 848-8000 to set up an appointment for a consultation and to see if you qualify for this treatment protocol. Not everyone is accepted for care. We only accept the patients who we feel that we can truly help and they qualify for this program. If you qualify and we accept you as a patient, you can start the treatment protocol the same visit or the next visit, depending on how busy we are. Unless you're coming from out of the state, then we're going to treat you and start the treatment on the same visit. It is very important for you not to wait as much as possible and get started. Why? Because arthritis usually becomes worse as time goes on. The sooner we start, the better response you may have and less chance that you may need a joint replacement surgery and go under the knife. I don't need to do this anymore. I do this because I have a passion to help people to live a better life so they can do what they want to do. They can go up the stairs. They can chase after their grandchildren, play with their children. If you get treatment or not get treatment, it's not going to change my life, but it's going to change your life. Yes, we do accept most insurance plans, including Medicare, and I want to thank you for watching this video. God bless you and your whole family.